Today we're going to learn how to take blood pressure. For that you need a sphygmomanometer. The kind that we are going to use is an aneroid type. You have other types like the mercury one, which is most accurate, but for purposes of this class we're going to use the aneroid type of sphygmomanometer. With that you also need a stethoscope. One important thing to remember when you're listening to the heartbeat or even to the sounds when you're measuring the blood pressure is the way to put the stethoscope into your ears. You have to make sure that these two ear pieces are pointing forwards like this way, because that's the way your external auditory canals are positioned. So you put these two ear pieces in, tap gently on the diaphragm to make sure that you hear the sound. If you don't, you have to turn this valve around and then you hit again to make sure you hear the sound. Now have the patient seated comfortably. Make sure that the arm rests on a table. Put the cuff, pass this cuff through and make sure that the cuff goes around the arm. It should not be over the cubital fossa. You should be able to see the cubital fossa clearly. So here you can see the cubital fossa clearly. The first thing you're going to do is clip this dial up here so that you can see it. Make sure these tubes don't get in your way. And then find out from the patient if he or she has been known to have high blood pressure. Now Alan here has normal blood pressure, so we take it that his blood pressure is not over 120. So we close this valve and we pump, and here you can see that the arrow moves up, and we'll take it to about 140. Make sure that the valve is closed tightly. Next, place your fingers, not your thumb, place your fingers over the radial artery which is present on just over the radius, the bone radius. And actually you should do that before you pump up because you won't be able to feel the pulse. So here you feel the pulse at that. Pump this up to about 140. Slowly release the valve. And you will feel the pulse coming back. I feel it around 110. So that gives you an idea what the systolic pressure would be. Once you know that the systolic pressure is around that, then what you do is put your stethoscope in, feel the tendon of the biceps, flex the person's forearm if you can't feel the tendon properly, and then medial to the tendon, make sure you feel the pulsations of the brachial artery. Place your diaphragm over that. Now raise the pressure to about 130. Slowly release the valve. You will hear sounds, a small beat, a tapping sound, and then the sound gets louder, and then the sound disappears. These are the Korotkoff sounds. The sounds are produced because of the turbulence of blood against the constricted blood vessels, and so when you start hearing the sounds, that is the systolic blood pressure. When the sounds get muffled and disappear, at that point the reading that you get, that's the diastolic blood pressure. A single reading is not enough to determine the blood pressure. You must take it thrice, and ideally you really should take it with the person sitting down, the person standing, and the person lying down, and then take the average of the blood pressure. So this is how you'll take the blood pressure in any person. The most important thing to remember is the person should be seated comfortably, or if they are lying down, make sure that they're lying down comfortably, or if they are standing, then again they should be standing comfortably, and you should be able to take it easily.